Knowledge about hypertension. Diabetes. Find out in SugarBeat, the Gets Pharma Philippines cardiometabolic social media platform. Knowledge about hypertension. Diabetes. Find out in SugarBeat, the Gets Pharma Philippines cardiometabolic social media platform.
Hello and good afternoon, ladies and gentlemen. Welcome to SugarBeat. SugarBeat is the official social media platform of Gets Pharma Philippines cardiometabolic line. SugarBeat aims to provide you relevant and timely information on the prevention and management of diabetes and high blood pressure. All page contents are designed for every Filipino to embrace the value of wellness and self-care.
Previously on SugarBeat, last time, our guest speaker has thoroughly discussed another topic that pertains to diabetes and hypertension. This gives us clarity on how we can face and manage this specific topic and condition. To watch the replay, you may visit the SugarBeat PH social media platforms. You can find us on Facebook, Instagram, and YouTube.
Taking your medicine as prescribed is important for controlling chronic conditions, treating temporary conditions, and overall long-term health and well-being. In today's SugarBeat webinar, our guest speaker will discuss the importance of compliance and adherence to medication to fight diabetes and other diseases. To start, please meet our speaker. He finished his ambulatory practice and diabetes care training at UERMMCISDFI. Has a diploma in advanced diabetology at Johns Hopkins University. Had his preceptorial in hospital diabetology at the University of Sydney. Had his diabetes foot care training at Theptarin Hospital, Bangkok, Thailand. An active consultant in the cardiovascular prevention unit at Davao Regional Medical Center. A teaching consultant in diabetes in Southern Philippines, Medical Center, Davao Medical School Hospital, Brokenshire Hospital, San Pedro Hospital, and Rivera Medical Center. SugarBeaters, please welcome, Dr. John Bosquet.
The importance of adherence and compliance in taking anti-diabetic medication. So, ang usual na to pangutana is, ang tambal ba sa diabetes, kinahanglan ba? Kinahanglan ba ipadayon? So, my name is Dr. John Bosquet. I'm a doctor who manages mostly on diabetes. So, we're going to talk about today is on the compliance and adherence of the anti-diabetic medications as well as anti-hypertensive medications. So what is adherence? What is compliance? So they're actually different. So when we talk about adherence, it is more on a positive note. This is a proactive behavior or an active participation of the individual in his lifestyle. So these are the types of individuals who does their exercise with a positive note, knowing that they will improve their physical condition. So what about compliance? Compliance is more on a positive behavior. So each individual will just follow instruction what the doctor will give. For example, your prescriptions that we give, you follow and comply the number of tablets you need to take. So this is the difference between adherence and compliance. So mostly adherence is for your lifestyle. That is part of your active management of your diabetes. Compliance is more on passive, in which the doctor helps you in giving your medications and guides you on what to take and how to take it. So, diabetes. There's a lot of questions regarding diabetes. So, diabetes is a disease actually in which our body is not able to metabolize or process sugars or carbohydrates. It is because it is not able to respond properly to our hormone, which is insulin. It can be also a cause of insulin resistance or both the lack of insulin plus insulin resistance as well. Meaning, ang diabetes, dili maka burn og asukal or carbohydrates sa ginakaon nato is because dili ta makahimo enough insulin or dili pud ta because of the insulin resistance. Dili dawaton sa atong lawas ang insulin na ginahimo nato. So there are different types of diabetes. So this is not a very common type, the type 1 diabetes. This is less common than the type 2. The most common causes of type 1 diabetes is autoimmune and genetics. So you are the propensity to have, when you get infection, your body destroys your organ, which is the pancreas, that makes insulin. So this will cause unmarked absolute insulin deficiency, meaning your body is not able to produce enough or no more insulin during the day. So what is the most common type of diabetes, which is type 2? Type 2 diabetes is caused by multiple defects in our organs, meaning the most common cause is when your body is not able to produce enough insulin or your body is not able to intake the sugars that is inside your body. So but there are a lot of common causes, such as your body increases the reabsorption of sugars, your body decreases the production of incretins, which decrease sugar. So there's a lot of causes, but the most common is that your body is not able to receive the sugars that is in the blood because of impaired insulin production and impaired insulin usage. And there is also another type which is recently becoming more prevalent, which is the gestational diabetes. These are usually developed during pregnancy. So there's around 18 to 20% of pregnancies which will have become gestational diabetes. So if this is not treated, it will cause more harm to the baby. So you have to see your doctor whenever you have gestational diabetes or a risk to become diabetic prior to your pregnancy. So with gestational diabetes, after your pregnancy, there's always an increased risk of becoming type 2 diabetes in the near future. So what is the usual risk factor for gestational diabetes? It's usually ethnicity. There's a history of family history of diabetes and obesity, which is common in our Filipino setting. So risk factors for type 2 diabetes, which is we're going to discuss right now because of the high risk in the Philippines. So obesity is number one cause. So as you can see in the slide here, that there's a very large young person who eats a lot of unhealthy diets, such as our processed food, processed drinks, which increase the risk for diabetes. And now, because of COVID, our kids has a lot of time using their gadgets rather than doing exercises. So we should advise our kids to have more physical activities rather than staying with their gadgets all the time. So another risk factors are stress, lack of sleep, which are common causes of increase in risk for diabetes. And there is also genetics. If you have a family history, there's also a higher risk to become a diabetic. How about drugs and supplements? There are some medications such as steroids which has a propensity to cause hyperglycemia or increase in sugars, and there are also supplements which are not properly studied which can also give risk to diabetes. Last 2019, the International Diabetes Federation Atlas shows that diabetes has been increasing in prevalence. Worldwide, in the next 2 decades, meaning in the next 20 years, there will be a 51% increase of diabetes in worldwide. How about us in the Western Pacific? As you can see below on your right side, diabetes will increase to about 31% in the next 2 decades. So we are in the Western Pacific, in the Asian Western Pacific. So that means 1 in 3 adults will become diabetic by that time. So this is a scary thought. So currently in the 2019 Atlas, it shows that Philippines is in the top 5. So we're about 4 million individuals have already become diabetic. This is only for those who have been statistically put in the DOH program. But how about those who are OFWs, those who are living outside in the Philippines, which are not really part of the statistics? So probably we are probably in the higher top 5 as well. So what are the complications of diabetes? So if you don't take your medications, you have very high risk to have cardiovascular disease. So meaning with diabetes, which is uncontrolled, you have 56% risk for hemorrhagic strokes. You will have a 50% risk to die of heart disease, like strokes, heart attacks, and you have 10 times higher risk to develop end-stage kidney disease. So 30% also risk to develop blindness and retinopathies, and 60% risk of non-traumatic lower limb amputations. So please do not wait until all this complication comes before you treat your diabetes, because when these complications are here now, it is so hard to treat it, and mostly it's permanent. This slide shows that top causes of chronic kidney disease. Before it was hypertension, now it's already diabetes. So top first and second are diabetes and hypertension, which increases the risk of chronic kidney disease. So what is the normal sugar levels of each individual? So this is based on the ADA, or the American Diabetes Association guidelines. So normal for the fasting plasma sugars are around 70 to 99 milligrams per deciliter, or about 3.9 to 5.5 millimoles per liter. So first after meals, it should be less than 140 milligrams per deciliter, or about 7.8 millimoles. So this is about 2 hours after meals. How about your HbA1c? What is HbA1c? This is the test we do every 3 months to check for your sugars, which are part of your hemoglobin, which is in your red blood cell. So it should be less than 5.7%. So this is supposed to be the normal. But for those who have diabetes and those who are taking medications, the official ADA recommendation for fasting plasma glucose for patients with diabetes are around 80 to 130. So that's around 4.4 to 7.2 millimoles per liter. And for their 2 hours after meals, it should be less than 180 milligrams per deciliter, or about 10 millimoles per liter. How about their HbA1c? So the official recommendation should be generally less than 7% for all population, but for those who have higher risk, or those who have lower risk, meaning rather for those who are young and low risk, maybe you can bring it down to less than 6.5%. Okay? So, how do we treat our diabetic and high patients? So, they're multifactorial. So, you should control their blood pressure, their cholesterol, and they should have lifestyle change. So, what I can show you first is usually medical nutrition therapy. So, they advise to reduce salt intake to about 1 teaspoon per day. You eat more vegetables, with little fruits, because fruits has a lot of sugars as well, so you have to control it. And some grains, yeah, to give you a little bit of energy for your carbs, but not too much. And you can eat your poultries or meat, some dairies, and some oils as well as seeds and nuts. But with this, you have to discuss it with your physician or your medical nutritionist, which will help you in the management of your medical nutrition therapy. So, lifestyle change. Definitely stop smoking. Because smoking doesn't really help you. It actually increases your risk for heart disease, as well as you lose a lot of money paying for the cigarettes. So, moderate alcohol intake. This was recommended by the American Diabetes Association, about 2 drinks for men. So, that's about 5 ounces of red wine, and so each drink, meaning, and 1 drink for women per day. Okay? Then weight control. So weight control, you should check your body mass index. So as Asians, our normal body mass index should be within 18.5 to 23. So you have to check your BMI all the time. So exercise is also very important. So you should have moderate intensity physical activity around 30 minutes per day for about 5 days, or about 150 minutes per week of brisk walking, jogging, biking, swimming, for those who are very heavy, and also weight training or resistance training, which gives us more muscle. So more muscle you have, the better you burn sugars. Oh, how about your medications? Now, we should take our medications in combination with your diet or medical nutrition therapy, plus your lifestyle. We should continue our maintenance medication. Usually, it's taken for life. So, there are a lot of anti-diabetic medications now in the armamentarium, and also you have to take your antihypertensive medication if you are hypertensive, or if your doctor prescribes it for you, because there's a need or a risk of other disease, which comes with your diabetes. You also have to take your cholesterol, antiplatelets, especially if you have all the risk factors. So, and also consult your doctor, your trusted physician, your primary care physician, to help you and guide you regarding your diabetes. Because if you take your own medications and you don't know what it is for, it is because your neighbor is taking it, it's dangerous, because even though you're both diabetic, you're actually different people with different genetics, different needs. So it's much better to see your physician, your doctor, to help you with your care for diabetes. Okay, thank you. How long would you take the maintenance medications? So one question here is that how long would you take? So it's usually a maintenance medication. Like I said in my slides, that your maintenance medication should be taken for life. So it can be adjusted based on your physician's plan, of how to treat your diabetes. So it depends on your doctor if he needs to change or to shift. But for in terms of compliance of your anti-diabetic and antihypertensive medications, that's about for life. There's also a question regarding Is there any tendency that uh, the dose of your medications can be changed if your sugars or BPs are very low? There's a tendency that your physician will change the dose to make it lower if your blood pressure is too low or your sugars are very low. But if it's normal, it's advisable to continue your maintenance medication, and please don't stop your maintenance medication because of your sugars and BP are already normal. So the question is regarding supplements. No? So what is the role of supplements, especially in patients with diabetes? So currently, there are no studies in using supplements in patients with diabetes and hypertension. There's no advice for us. There's no strong studies that could actually advocate the use of supplements in treating diabetes and hypertension. So, is there any effect of your anti-diabetic, anti-hypertensive medications in your kidney? Would it cause any problems in the long run? Not really. The one that's causing your kidneys, like I showed you earlier in my slides, that the diabetes and hypertension is the number one cause of kidney disease. So if you don't control your sugars or your blood pressure, that actually will cause your kidneys and your diabetes and your kidneys to go. So it's nothing to do with your medications. So in your medications for hypertension and diabetes, what is the effect regarding these medications in the COVID-19 vaccine? So currently, there are no studies that cause any problems with these medications in combination with the use of the COVID vaccination currently on the run. So it's practically safe to continue anti-diabetes and anti-hypertensive medications. So if you take your anti-diabetic drugs, uh, well, do we have to stop when the sugars are low? Yes, like I said before, if your sugars are normal, you have just to continue your anti-diabetic medications. But if it's too low, please check with your physician, and he or she might need to adjust your anti-diabetic medications or adjust your medical nutrition therapy. So would it help using pill box? No? So for compliance, yes, I advise if you have a lot of medications, a pill box would help. No? So you'll be guided that if you've taken your medication for the day, it's safe to use double dose. No? If you forget to take your medications, like you forgot today or tomorrow, you forgot to take your medications in the next 2 to 3 days, would you need to double your medications? No, actually, you don't need to double your intake of your anti-diabetic or anti-hypertensive medication. You just have to continue it and monitor your sugars and blood pressure. Normally, your anti-diabetic, anti-hypertensive medications would last around 24 hours and a little bit more for some. So as parting words, I just want everyone to know that you should seriously treat your diabetes and hypertension, not just put it aside, and make sure that it's always in control. You visit your trusted physician. Is because your body is given to you only one. So you have to take care of it properly so that time will come when you get old, you won't lose a lot of money because of your sickness. Because so hard and you don't take care of yourself, time will come you will lose a lot of your money. So take care of yourself. Please trust your own physician and trust your provider for your medications so that you'll be able to live longer and enjoy your life. Thank you. So, ang kaalaman tungkol sa diabetes at hypertension, mag-follow at subscribe na dito sa SugarBeat PH.
Thank you to our guest speaker for providing us another informative virtual session here in SugarBeat. For more information like this, please like, follow, and subscribe to SugarBeat PH social media platforms. You can find us on Facebook, Instagram, and YouTube. Next on SugarBeat, come and visit our page to watch another exciting webinar topic that will leverage your knowledge about diabetes and hypertension. Do you have a question about diabetes and hypertension? Our chatbot is ready and at your service. Please send us a message on our official Facebook page Messenger, and we'll try our best to get back to you with the answers. Consult your doctor while you're at home with Dokuto telemedicine application. You can download this to Apple Store and Google Play Store. Once again, thank you for joining us and see you again on our next program.